Hey guys, this is Amanda Bassingthwaight with the Christian County Health Department, and we're here today to do a quick CCHD chats with you guys to catch up on some health topics here in the community. It's been a little bit since we've talked to you guys. So first of all, Happy New Year from the Christian County Health Department, and we apologize that we're running a little bit behind this month on our chats. But the beginning of the year has been busy. You're going to hear about some of the things that have been going on. But one of the things we want to start off with and talk to you guys about is hepatitis A. That is the topic of the hour. Everyone's had lots of questions about it. We've heard about it in the media. And I brought in our epidemiologist. This is Blake Johnson. I called her Blake Shelton a while ago. That is not correct. Blake Johnson. And she's our epidemiologist here at the health department, and she's kind of our disease detective, and she's been keeping a close eye on hepatitis A in the community. So I wanted to bring her in to talk to you guys for a minute. First of all, what's our numbers so far with hepatitis A?
So our numbers are up through January 12th.
Okay.
That's what's been reported by the state. Kentucky reported 3,719.
In the state of Kentucky?
In the state of Kentucky.
Okay, so for Christian County?
Christian County, we have 14 reported.
Okay.
1 is confirmed, 11 are probable, and 2 are suspect.
Now what's the difference between probable and suspect?
So probable is they have tested positive with their local provider,
Okay.
but we have not got results back from the state.
Okay.
So once they come back from the state, if they have symptoms, they get moved into probable.
Okay. So what are some of these symptoms that we should be looking for with hepatitis A?
So symptoms to look for are abdominal pain, usually around the liver area because the virus does affect your liver.
Okay.
Change in your skin color or your eye color. It's more like a yellow or orange color.
The jaundice.
Yes,
Is that right?
the
Okay.
jaundice. And then nausea, vomiting, diarrhea. A big one is the change in urine and stool color.
Okay.
So the easy way to remember that is urine is going to change like a Coca-Cola color,
Okay.
and the feces or stool is going to change to like a peanut butter color.
Okay.
It's a really gross
So
way.
very big indicators there.
Yes.
Okay, things to look for. Well, how is it spread?
Okay. So in the past, it's been spread typically by infected food handlers,
Okay.
but now this outbreak's a little bit different. It is mainly illicit drug users.
Okay. And that kind of targets our high population. That's kind of who we've been targeting in the community, correct?
Right, that's who we've been targeting, illicit drug users and homeless individuals.
Okay.
Just because they don't have access to washing their hands, which is a big part of keeping the spread
Yes,
down.
and we've talked about that a lot on the radio. We've also talked about that a lot with all of our media partners and those in the community. Hand washing is one of the biggest things we can do as a community to keep the spread of this disease. Is that correct?
Yes.
Okay.
And the other thing is getting your Hep A vaccine.
Which we have.
And it's great because the Kentucky required that as a school immunization this year.
Oh, that's right. So school kiddos and parents, make sure your kids have the Hep A vaccination that was on the roster this year. I know the schools are keeping a tight rein on that. We offer that here at the Christian County Health Department. So if you have any questions about anything we've talked about today or anything in addition about the Hep A vaccinations, you can always give us a call here at the Christian County Health Department. One other thing I want to talk to you guys about on a different topic is January is Birth Defects Prevention Month. So there's a lot of different things we can do for those pregnant mothers out there to make sure we have healthy, happy babies. Oh, there's our Hep A slide. But National Birth Defects Prevention Month, one of the things you definitely need is your folic acid. That's going to help in healthy development of baby. Talk to your provider. He or she's going to make sure you get the folic acid that you need. So if you are pregnant, make sure you're visiting your provider to get all the nutrients that you need during your pregnancy. Another thing you can do, anytime you're on medication, before you stop or start medication, again, talk to your doctor, make sure that those medications are safe during pregnancy. You want to have a good relationship with your physician to make sure that you stay safe and healthy for baby. Make sure you have your vaccinations, especially your flu vaccinations. This is a great plug to talk about. It's time to get your flu vaccination if you haven't done it. We've been talking about it for several months now. The flu is rampant. Do you have any numbers on the flu off the top of your head?
I don't.
I know they increased pretty significantly from December to January.
They did, and the predominant strain this year is H1N1, which is more harmful to kids than older adults. So it's really important that the kiddos get their
your flu
vaccine.
shot, absolutely. And I believe we vaccinate here 6 months and up, correct?
Mhm.
So make sure all the family come in and get your flu vaccination. But especially this month, since we're talking about pregnant mothers, make sure you get your flu vaccination. Make sure before you get pregnant to try to maintain a healthy weight. Being overweight or underweight before you get pregnant can cause some complications during pregnancy. So it's always good practice to maintain a healthy weight. And last but not least, make sure you avoid drugs, alcohol, and smoking during pregnancy. This can be harmful not only to you as an individual, but also to baby. And we have some great programs here at the Christian County Health Department, smoking cessation programs, lots of resources for you if you're having issues with any of these things. If we don't offer a program to help you, we can definitely put you in the right direction. So I think that's everything in a nutshell we needed to talk about today. If you have any questions, give us a call at 270-887-4160. We'll be happy to answer any questions you have. Thanks, guys.
Bye.